Good morning, everybody. Thank you for joining us for this press briefing on the state's response to the coronavirus pandemic. Want to start off, as always, by reminding people that we still need to continue to work on slowing the spread of the virus here in our state. We are at a record number of hospitalizations, 613, and that means we need people to pay special attention to washing their hands often, wearing a mask, keeping that 6 foot of distance between you and other people when you go to public and go in the public. We've talked about avoiding the 3 C's. That means close contact, confined spaces, crowded places. It's a virus that spreads from person to person. It's a respiratory virus. So the closer you are to somebody, the more likely, if they're infected, that you could get it. Wearing a mask will protect you and other people. So again, please make sure you're thinking about all these things. If you can't keep that 6 foot of distance, if you're in a crowded space, if you're in a confined place, make sure you're wearing a mask, because that will help slow the spread of the virus. We see a lot of community transmission of the virus right now, and so it's important that we take these common sense steps to be able to slow the spread of the virus here in our state. Second thing I want to remind people is Test Nebraska is available for anybody to get a test. Anybody can get a test from testnebraska.com. We've tested over 371,000 people in Test Nebraska. So please continue to use Test Nebraska. It's free to everybody. Sign up, look for a spot. You can get in pretty quickly. So please, think about Test Nebraska. If you're going to go see a grandparent or something like that, that's a great opportunity to get tested ahead of time. In the last 7 days, we've been turning around those tests in 29 hours, so in just a little over a day. So again, a great opportunity to go get tested. And of course, all this is about making sure that we continue to preserve our hospital capacity. Right now, we've got 32% of our hospital beds available, 37% of our ICU beds available, and 77% of our ventilators. So again, the reason we do all this is to protect our hospital capacity, provide that hospital bed to anybody who needs it when they need it. So again, it takes everybody in the state working together to be able to slow down the spread of the virus. So please, please, please pay attention to the tools we've given you to be able to slow that spread. All right. So a couple things before we get into our speakers. Want to hit upon that. One, I've just done 2 new executive orders. One is with regard to public board meetings. So this would be like your school board or your county board. That executive order allows those board members who are quarantining or isolating because of a directed health measure to be able to attend those meetings electronically by Zoom or something like that and be counted for quorum and be able to vote. So this is in recognition to allow continuance of government with those public board meetings for your local school board, for example. If you've got people who are quarantining or isolating, letting them be able to participate as long as the public still has access to the meeting, but allow those people to participate if they're quarantining or isolating by some sort of electronic means. So that's the first executive order. The second executive order that I'm doing allows poll workers to be shared across county lines. So this is just to make sure we have plenty of poll workers for tomorrow's election. So that will be the second executive order that they'll be putting out, that will be going out today. And then, of course, that leads into that we've got the election tomorrow. So again, encourage everybody, if you've picked up an early ballot, do not try to mail it now. It is too late to mail it. You have to take it into the election office or take it into your county secure drop box, because it has to be there by the time the polls close tomorrow. So the post office will not have time to be able to deliver it now. So you're going to have to go hand deliver it into your election office or your wherever your county has to be able to collect those ballots to make sure that it gets counted. And just as a reminder, again, polls close tomorrow at 8 p.m. Central Time, 7 p.m. Mountain Time. So that's why you have to get those. If you received an early ballot and you want to get it in, it's too late to mail it. Make sure you take it in there and get it delivered. The other thing I would remind people is just please be patient. I don't know what the lines are going to be like at the polling places tomorrow. I suspect they'll be mostly light because many people have voted early. I voted early actually on Friday. There were long election lines. Everybody was great. People were civil. Just want to remind people that while we may disagree on the candidates we're voting for or the ballot initiatives we're voting for, that we are all the same team here in Nebraska. We're all Nebraskans. Show a little grace if we have some lines or whatever. Please be patient with other folks, especially during this pandemic. Also want to remind people that we are working very hard to keep schools open. That as we have worked with our Department of Education and the local public health directors, what we have found is that schools are a very safe place for students, that the transmission rate in schools is very, very low compared to the, in general, if you look at most of the cases that occur either in students or teachers, it's actually coming from the communities. I think our public health directors would tell you they're bringing it into the schools, not getting it at the schools. So we are working to keep those schools open. We know that schools are important not only for academic progression, but also because kids get other benefits from school, right? Socialization, just the mental health that goes along with that, the physical activity, the nutrition. Many students, get nutrition assistance from school. So it's important that we keep those schools open, and we are. Also, I would remind people that you may recall earlier this summer, Dr. Robert Redfield from the CDC said that drug overdose deaths and suicide deaths among high schoolers was higher than COVID deaths. So we see that, again, that when you're talking about balancing off everything, that it's important to have kids have access to those resources that are in schools to help limit this. And sadly and tragically, here in Nebraska, we see the same thing. The Omaha World-Herald ran an editorial last week that talked about how the number of suicide deaths among people 19 or younger in Douglas and Sarpy County was more than double what it was last year. And by the way, that rate is 10 times the rate of COVID deaths of people 19 or younger. So again, we need to keep kids in school. Again, this gets back to all the tools that we've given everybody with regard to slowing the spread of the virus. Wearing your mask, keeping that 6-foot distance, washing your hands, avoiding the 3 C's. All those will help us make sure we slow the spread of the virus, keep kids in schools. That's going to be the best place for kids is going to those schools. So we talked about the death rate, or the number of deaths that we've had, rather, in Douglas and Sarpy County from suicides of people 19 or younger is 10 times what it is for COVID deaths. So we want to make sure we continue to work on keeping our schools open. And then also I want to give a update from our vaccine plan last week. There was a question asked about, is this going to be free to everybody? And then the question came up of administrative costs. The White House had our governor's only phone call last week, and they were very clear that anybody who gets a vaccine will not have to pay for it. That whether it's going to be Medicare, Medicaid, or your private insurance provider, all those costs will be picked up by those organizations. There will be no copay. There'll be nothing like that for people who get that vaccine. It will all be free to those folks. So, and then, that's all been covered. The White House has worked it out with the insurance companies, Medicare and Medicaid. So that will all be free. You will not, if you get that vaccine, you will not expect to have to spend any money out of pocket to be able to get that. All right, so just an update on that. Next, I want to get to our long-term care facilities. They really have done a tremendous job here in our state in working hard to protect our seniors in that congregate living. One of the things that we've done here in Nebraska, going back 4 years ago, is the state of Nebraska had a grant from the CDC, and we worked with UNMC to create the ICAP program, or the Infection Control Assessment and Promotion Program. And this is a program, again, we started this 4 years ago to help train long-term care workers about slowing the spread of infection. Well, obviously that has paid big benefits as we have moved into this pandemic, and we've seen long-term care facilities use those tools that we've been teaching them over the last 4 years, as well as the UNMC has continued to provide those classes and training. They've done webinars. Shelley Sweethome has done on-site visits to long-term care facilities to help them train in things like putting on your PPE and taking off your PPE and quarantine zones and things like that. So they've worked very, very hard to be able to do that. Dr. Ashraf was talking about the deaths in nursing homes being about 1% here in Nebraska, where in some states deaths in nursing homes were 10% of the population. So we've certainly seen our long-term care facilities really do a great job of taking care of the residents. But that's also been very difficult. There's a lot of people in those long-term care facilities working very, very hard to be able to do that. and those long-term care facilities have incurred additional costs to be able to implement the protocols to be able to keep people safe. So to recognize the additional costs that long-term care facilities are incurring, we've got Jerry Brunson, who's our interim director of Medicare and Medicaid and long-term care, to talk about what we, the state, are going to be doing with regard to providing more resources to those long-term care facilities to be able to offset those costs that they've been incurring and be able to continue to provide that great care they've been providing to the folks in our long-term care facilities. We also have Heath Bodie from the Nebraska Healthcare Association going to be talking about that as well. And then Jennifer Cerno from Leading Age Nebraska will follow Heath to be able to talk about that as well. We've had numerous conversations, numerous phone calls with Heath and Jennifer and the other long-term care facilities. I know Dr. Antone has had a lot of conversations, so it really has been a team effort to be able to work on keeping our seniors safe in our long-term care facilities. So with that, Jeremy, I'm going to call you up, and could you talk a little bit about what we, the state, are going to be doing through Medicaid to be able to help out our long-term care facilities?
Good morning, and thank you, Governor Ricketts. As referenced by Governor Ricketts, we've, at Medicaid specifically, been engaged with Jennifer and Heath, their associations, and independently with providers who've reached out to the department as well, just looking for support from us to help them stem the tide through this pandemic. So through working collaboratively with providers and the associations, we are proud to let you know that we are in the process right now of seeking federal approval to do a temporary increase to the Medicaid per diem, so the daily rate that we pay both nursing facilities in Nebraska and assisted living facilities in Nebraska. So in total, what our plan is we're looking to increase the temporary rate by $20 a day, going backwards to May 1st. So that rate would be effective beginning for any dates of service beginning May 1st and would run through the end of this calendar year as of right now, ending on 12/31 of 2020. So this is a significant amount of money. We expect this to likely bring close to $40 million to long-term care facilities in Nebraska that participate in Medicaid. We are looking to implement this in a relatively quick time frame and expect those payments to go out the door in this month in November. And we're also doing so in a way that we're trying to limit any burden on long-term care facilities. So it's our intention that we'll be able to actually reprocess claims and not require any specific actions from providers to get this money out to them to support them during this time. I'd also let you know that our managed care partners who do have some claims from our long-term care industry will also be supporting this effort. While most of the volume for long-term care does fall within the fee-for-service line of business in Medicaid, our managed care partners do have some, and they'll also be participating and helping out with this. So I just want to say thank you for the information and the collaborative working relationship that we have, and for to the administration for all the work on this effort to date. I'd like to now turn it over to Heath.
Good job, Heath.
Thank you, Governor Ricketts. Well, good morning. And as Governor Ricketts said, I'm Heath Bodie from the Nebraska Healthcare Association. And on behalf of our over 400 nursing facility and assisted living providers, I have to start my remarks this morning with thank you. You know, a word that strikes me today especially is impact. And I think about the impact that financial assistance like this will have on providers who literally have been in the throes of this since the beginning, this invisible monster that so quickly can permeate one of their facilities. Governor Ricketts started early by opening lines of communication, making sure that not only Jennifer and I, but also the providers in Nebraska had an ability to talk with decision makers here in the state, and impact strikes me there as well. We talked about ICAP and Dr. Ashroff and other professionals from UNMC and how we are so blessed in Nebraska to have that expertise to guide us. And, you know, frankly, the numbers, while every death is a tragedy and is significant, we're pleased that we could start to hold those numbers a bit as we've seen different in the rest of the country. And then I think about the impact of team members. And Governor Ricketts has been really good to call out those frontline team members, all team members in the long-term care facilities. as again, they know what they're facing each day. They realize they're putting themselves at risk, yet they get up, suit up, if you will, and go back in day after day. I just want to, as I kind of wind up my thoughts here this morning, I just want to implore Nebraska communities along the lines of what Governor Ricketts has been and is encouraging us again today. See, one of the things that we've learned in long-term care, in nursing facilities and in assisted living, and I know many of you that are listening across the state care a lot about those facilities that are in your community, but what we've learned is that your behavior as a community drastically affects our ability as nursing facilities and assisted living facilities to keep the virus out. Specifically, your willingness to wear a mask, your willingness to social distance, your willingness to follow the 3 C's. And so I encourage you, as we're about to head into significant holidays all across the state, to be mindful of that it's not just actions that will affect you. There are actions that will affect others in your community, but specifically the congregate elder environments. So Governor Ricketts, thank you again. This could not be more impactful. Jennifer and I were talking earlier, frankly, for some of the communities across the state, from a business perspective, this will be life-saving for them in business. So I thank you again. Dr. Antone, thank you again. Jennifer?
Good morning. I'm Jennifer Acerno with Leading Age in Nebraska, and I really would like to echo the comments that Heath has made this morning, and also like to thank the governor and the team at DHHS for all of the work that they have done and coming to a point to be able to acknowledge the need for additional funding for long-term care at this time. We have teams who are out there working very hard in long-term care for the past 8 months who have been in overdrive, to say the least, and have been assisted by DHHS and specifically, as was mentioned earlier, Dr. Ashroff and the ICAP team at UNMC. They've been an invaluable partner to us. Along those lines, I would say that the providers in long-term care have been working tirelessly, but are probably tired, have been really digging in to make sure that loved ones are taken care of, whether those residents and families are able to see each other obviously has been an issue, but those providers are really in there trying to meet all of those needs, which is taxing on them. So I just want to say thank you so much to our long-term care providers who are out there, who are really going the extra mile, not only to keep people safe, but keep them engaged on a social level. So thank you to those providers. I want to say that your commitment to what you're doing does not go unrecognized. We appreciate it very much. And to all of those essential workers out there, thank you. And I am going to turn this over to Governor Ricketts for Q&A now.
Great. Thank you very much, Jennifer, Heath, Jeremy. Thank you very much. And again, this is additional resources on top of the testing resources and the PPE and all the other things we've been doing for the long-term care facilities. And again, I just want to echo what Jennifer and Heath were both saying with regard to our long-term care facilities workers, all the folks who've been getting up each and every day to take care of our seniors in those and the residents in those facilities. They really are working very, very hard to be able to keep people safe, and the hard work is paying off. So we appreciate all the work of all the members of your association. Okay, now we'll go ahead and get into Q&A. And Taylor, where are you? Taylor, you want to shoot me some of the questions that were sent in ahead of time?
Yeah, we just have one from Becca Costello. She asked, several infectious disease experts say we've gotten better at treating coronavirus patients compared to earlier in the pandemic. Knowing that, could stricter health measures have prevented some of the deaths in Nebraska?
So Becca Costello from NET is saying she spoke with infectious disease doctors who said we're better at treating the patients now in hospitals, and so would have tighter restrictions have prevented more deaths. And while certainly every death is tragic, and we're working to reduce it, one of the things that our experts told us early on, this is a virus. You can't stop it from coming. We took steps early on to be able to slow the spread of the virus. We're continuing to take those steps to be able to slow the spread of the virus. And here in Nebraska, we've been able to preserve our hospital capacity. That's really the program we put together, is slow the spread of the virus to make sure we can provide that hospital bed. And we've done that. And then, if you look at, for example, some of the Statistica ranks fatalities per 100,000, Nebraska's in the bottom quartile of that. And again, I think you just look at the work the long-term care facilities have been able to do to be able to prevent those deaths. We've done very well here in Nebraska. Obviously, like I said, every death's a tragedy, but we've been working very hard to prevent those deaths. That's all we got? Okay, great. Fred?
Governor, where's the $40 million gonna come from, and what are the opportunity costs? What could be done?
So the $40 million, so Fred Knapp is asking, where's the $40 million coming from that we're going to be providing to long-term care facilities, what's the opportunity cost? In part, this will be, we're getting increased aid from the federal government through our FMAP to be able to help provide that. And Jeremy, I'd ask you to come up and just be able to, if there's anything additional you want to say about that. Oh, he said I covered it.
All coming from
Basically,
federal.
we're getting increased federal funding, and so we'll be able to provide those additional funds as part of our overall budget in Medicaid.
So, to clarify, is the 40 million all coming from the federal government?
So the question Martha was asking to clarify, is that 40 million all coming from the federal government? We, the state, will have to do our match as a part of that. And Jeremy, what's that match right now?
$15 million.
$15 million will be coming from the state as part of our overall match, and the federal government will be matching the rest.
So it'll be 15 state and 25 federal.
Yes, 15 state, 25 federal.
And where's 15 coming from?
Again, we will just manage this within our budget. That's what we do. So, we have resources at the state, and we will make sure that by constraining our spending across the board, we'll be able to provide the state part of that. And also, you may notice that our revenues have been running ahead of forecast as well this year. Andrew?
Governor, how will the money be spent, and how do you ensure that that money will be spent towards the workers, the frontline workers?
So the question was, how will that money be spent, and how do you ensure that it's actually going to the workers? And I'm going to ask my panel of experts here. Heath, you want to come up and talk a little bit about that? That'd be great. And then Jennifer, I'll give you a shot at that too, since you're the one representing the providers.
Yeah, thanks, Andrew. That's a good question. So the question was, how will the dollars be spent, and how do we ensure that the dollars go towards frontline workers? So the idea here is that that providers have already been spending resources on workers throughout this entire pandemic. In fact, the costs have inflated at an incredible amount, and I'm sorry I don't have that data in front of me to tell you exactly. So part of this financial support will help them cover some of the costs they're already incurring. It'll also allow, in my mind, the ability for a provider to maybe increase wages if they need to, maybe to pay some retention incentives if they would choose to, and to probably recruit some more people. I think you're aware, Andrew, especially with conversations we've had in the past, the number of challenges that providers have had from a workforce perspective. So this financial help could not come at a better time. Jennifer, do you want to? No.
Jeremy, is there anything you want to add?
Oh, I think I covered it well.
Martha, did you have a follow-on question?
Yes, I'm interested in whether you're able to acquire PPE, the amount that you need. I know that there have been problems with that in the past.
So the question Martha's asking for our long-term care facilities is about PPE and the ability to acquire that. And so Heath and Jennifer, Jennifer, we're going to give it to you this time. We'll let you tackle that one.
So yes, over time, PPE has been difficult to acquire. I think some of that was really timing as far as being able to get a lot of PPE available. However, DHHS has been working closely with providers and helping to obtain that, and now has PPE available. Of course, there are always some shortages depending on what might be a shortage across the nation that are being dealt with, but otherwise I think providers have made significant strides, in particular probably in the last few months, in being able to acquire necessary PPE and with the assistance of DHHS as well.
Governor, since we're focusing on long-term care, I'd like to ask Dr. Antone for the latest statistics.
Dr. Antone, can you come up and talk, give us some of the latest statistics with regard to those long-term care? Thanks.
So as of yesterday, The number of residents now that have tested positive in long-term care is 1,774. The number of staff is 1,832. As the governor mentioned, the deaths are at 238, which now represents 36% of our overall deaths in the state. We had been running close to 50% at first, and then down to about 44, 45%. And then over the last month or so, down now to 36%. About 312 out of the 496 long-term care facilities have now been affected with either a staff or a resident affected by COVID.
Thank you, Dr. Anton. And if I could just emphasize something that Heath talked about with regard to just people in general in the community, making sure that you're taking those steps to be able to slow the spread of the virus, you know, avoiding the 3 C's, washing your hands, wearing a mask, keeping that 6 foot of distance. All the folks that work in our long-term care facilities live in the community, right? So if we reduce the amount of virus that's floating around the community, that reduces the chances that somebody, one of the staff members, for example, picks it up and takes it to a long-term care facility. So specifically, I just want to emphasize Heath's point about that it takes everybody in the community to be able to help slow the spread of the virus so that we can help make sure that we're keeping our residents in long-term care facilities healthy. The other thing, just with regard to PPE, is that we have a robust supplies of PPE at the state level, in some cases more than 3 months' worth. And so we distribute that out to long-term care facilities through the local public health department. So if there is a specific facility that is running short on PPE, they ought to contact their long-term or their local health department to be able to get access to it. The only thing I know that we are really still, and we're not even struggling that much with, is the N95 masks. So we are getting more supplies of those, but we are targeting those masks to people who are dealing directly with coronavirus positive patients. Andrew.
Do we have an update on where we were, the financial health of the long-term care facilities? How many, we've heard some predictions of they weren't doing very well before the pandemic. Don't know how many have gone out of business during the pandemic or what financial stability they were in.
So Andrew's asking, what is the financial well-being of our long-term care facilities? Obviously, some facilities were challenged before the pandemic, and now with the pandemic, have we had any long-term care facilities that have closed? And Dr. Anton, I can't think of any off the top of my head. Do you know?
I would think Heath or Jennifer would know that.
I'll bounce over to Heath or Jennifer.
Sure. Nothing's closed.
So, yeah, we've had nothing closed since the pandemic has begun. Do you have any comments on, you want to come up here and talk about the just general financial well-being of long-term care facilities?
Well, thanks for the question, Andrew, and the question about the general financial health of nursing facilities and assisted living providers. And certainly, it has been a challenge and likely will continue to be a challenge going forward, but substantial financial support, like we're discussing today, will have an absolute and immediate impact on their ability for business operations to have survivability attached to them. Some of the most susceptible providers would be those that are by themselves, if you will. So maybe a community that owns a facility in a rural area where the population in the area is pressurized a little bit from there's not as many people in that part of the state. This support will have, again, an immediate and impactful effect on those facilities.
So it's going up by $20 a day against the base of what?
So the question is, it's going up $20 a day against the base of what? And I'll get close. I think the average Medicaid rate's $160. No.
Closer to $200.
It's closer to $200. So it sounds like it's almost 10%, Fred.
What's the cost? What's the general cost of care? It doesn't cover the cost of it, still does.
Jeremy, do you want this? Yeah.
So the question from Andrew at KTV was, what's the cost? Oh, sorry. What's the cost? Habit.
What's the cost of providing that long-term care?
Of providing the care. So it really varies by facility. We have roughly 200 nursing facilities in the state. We collect cost reports on all 200 of them, and we see big differences across the state. When we look at it average-wise, this was the first year, I believe, that we actually had a positive number in terms of appropriations were sufficient for the cost that was allowed in the rates for development. So that's been a difference than I think maybe what's been reported in the past. So there is support, obviously to give additional appropriations, and that had an impact. So each year, we do collect cost reports. We have them for state fiscal year 20 that closed out in June, but we don't have all of that data aggregated and audited at this point, so I can't provide any further updates right now.
Do you have an average cost, across the state?
So it would have been a little bit under the rate of $200 a day, since we actually had appropriations that were sufficient to cover the daily cost in general.
The $200 would have covered the cost.
Yes. Yep.
Martha?
So, Governor, given the fact that we've seen rates of cases increasing here in Nebraska, and we have some UNMC experts predicting that it's going to get worse, do we need to do more than what you've been talking about so far? I mean, you've been talking about the 3 Cs for a while, you've been talking about masks and avoiding crowded places and the social distancing. Do we need to do something different to change the trajectory?
So the question was, with regard to the number of hospitalizations has been increasing significantly, and, more cases and so forth. Do we need to do more? And you may recall that it was less than 2 weeks ago, we put in an additional, or we kind of tightened down those DHMs. For example, taking indoor gatherings down to 50%, requiring hospitals to keep that cushion of 10% and so forth. And generally, it takes 2 to 3 weeks after you do take an additional step to know if that's going to be impactful. So we are continuing to monitor whether or not we'll need to do more with regard to our directed health measures. And, obviously, we launched our Avoid the 3 Cs campaign about the same time, so it was about 10 days ago as well. So we're going to continue to monitor where we are with regard to that and take additional steps as we think necessary. But again, to remind people, once you put in a step, it's a minimum of 2 weeks and more like 3 weeks before you actually see the impact of those additional steps.
Governor,
Yeah.
I'm wondering, what's your plan for tomorrow night as the election results start to come in?
So the question is, what's my plan for tomorrow night? And a lot of the election night, generally you have big election night parties, and there's going to be a lot of people. Well, we're actually not going to be doing that this year because of the pandemic. My understanding is most of the candidates are doing smaller friends and family type events, and so I will probably just go hit a few of those in Omaha, stop by for a few minutes to congratulate the candidates and say thank you to the volunteers, and we'll avoid the typical large parties that we've had in the past.
And what was your reaction this past weekend? Wisconsin obviously declares that COVID, that game got canceled. Nebraska made an attempt to reschedule with Tennessee Chattanooga. The Big Ten shot that down. What was your reaction to all of that took place over the past week?
Yeah, the question was, what was my reaction to Wisconsin not playing this week because a number of their players coming down with coronavirus, and then the University of Nebraska trying to get Tennessee Chattanooga, and that not working out because the Big Ten nixed that idea. And again, we're disappointed that Wisconsin could not play. Certainly understand if they had coronavirus among their players, their reasoning for that. The Big Ten sets up the rules for how we can do it. Very disappointed the Big Ten did not allow us to be able to play that additional game. I think we could have managed it here. And that would have given another data point, I think, for the Big Ten to be able to talk about how they're going to be doing down the road in the bowls and so forth. But, we follow the rules of the Big Ten. While it's disappointing, we just want to make sure that we can do all we can do to keep having football games, and we'll just take it 1 week at a time. Fred.
When you were talking earlier about remote participation in public bodies meetings, that reminded me of something you had issued a DHM on like a week ago. Is this something new?
So my executive order with regard to the remote meetings is new. You may recall that early on in the pandemic, so last spring, we waived the requirement to have those public meetings entirely. Then we let that expire, and so the public meeting aspect of our law became back in force, which means that you have to have that public meeting, allow the public in, your board members all have to be there. What we're finding over the last several weeks is because of the number of people who are quarantining or isolating, that boards were having difficulty being able to get quorum, and so that's why we're going to allow those board members to participate electronically so that your public school board, especially as we approach the end of the year, a lot of these boards have a requirement on how many meetings they have to do, be able to have those meetings before the end of the year. We're going to allow those board members to be able to participate remotely to be able to do that. But still, the regular board meeting will still have to happen. You'll still have to have public access and so forth.
Well, I understand it the way you explained it today, but am I just misremembering that you had issued something along these lines about a week ago?
We did put that out a few days ago. I just wanted to remind people, again, though, that this is out there because that message hadn't been getting out there often. It was not part of our DHM, though. This is a separate executive order. Martha?
On the vaccine plan, you said that there would be no cost for Medicare, Medicaid, private insurance. What about people who are uninsured?
Oh, thank you very much, Martha. So Martha's question said, hey, I said there would be no cost for people who are on Medicare, Medicaid, or on your private health care insurance. What about people who are uninsured? Those costs by the providers are incurred. So again, people who are uninsured will also get the vaccine for free. There'll be no cost to them, no copay, nothing like that. The providers who provide those vaccines will get reimbursed out of the same fund that we were paying for the health care for folks who are uninsured. So you may recall, again, we made the announcement last spring that anybody who has coronavirus and goes to the hospital, even if you're uninsured, the cost of that will be covered by the federal government. And that's the same, that same fund that covers those healthcare costs will also cover the cost for the vaccines. And Gary, do you remember what the name of that fund is right off the top of your head? Do you remember, Jeremy? I do not. I can't remember. We can get you that information, though, Martha. There's a specific fund that's out there. I just can't remember off the top of my head. Yeah, Andrew.
Going to the quorum, for the public board meetings, is there any question about the legality of those meetings? Because there wasn't a law change, I guess, in the open meetings law.
So the question is there a question about legality of those meetings with my executive order? And actually, Andrew, what I'm doing is waiving a statute that's in law that will allow them to be able to do this because of the public health emergency. So there's no question of legality because the law that required them to be there in person, I'm actually waiving that part of the statute so they don't have to be there in person.
And can you tell us, when you voted on Friday, did you actually stand in the line along with the rest of the folks? And if so, did you get any pizza?
So Martha's question, did I actually stand in line Friday morning with everybody else, and did I get any pizza? The answer to the first part of the question is yes. I arrived about 8:15, and I think I got in to vote about 10:15, 10:30, somewhere in that time frame. So it was a little over 2 hours wait in line at that point. But no, I didn't get any pizza because apparently I was too late. It wasn't lunchtime or whatever, but the person who was ordering the pizza did not provide it there. But I do want to compliment the folks at the Douglas County Election Commission office. They were out there handing out bottles of water, hand warmers, thanking people for voting. So I think the team there did a great job. Obviously, it was a very, very busy day. So I appreciate all the great work of the folks who were at the election office. Did a good job. But yes, I waited outside in the 30-some degree weather for over 2 hours. Andrew.
And the poll workers, you go to the poll, you got a little bit of fever or a little bit of a cough, can you still come vote?
So the question was, if you've got a fever or cough, can you still come vote? And the answer would be no. If you're sick, you're supposed to stay home. So if you're symptomatic, please stay home, just like we've been saying all along. If you're sick, you need to stay home. And that's why doing the early voting was a great option for a lot of people to be able to make sure you could actually get your ballot cast.
And how will that be enforced, or what will happen? I guess if you come to the polls and you have a fever or you have a cough.
So the question was, how will that be enforced? And we're really asking people to do the right thing. Look, do the right thing. If you're sick, please stay home on Election Day. I know it's important to get your vote in, but again, if you're sick, you're supposed to be staying home. So I don't know that we have a way to enforce that other than asking people just to, use your own good judgment. Please don't put somebody else at risk. If you know you're sick, stay home. Okay, any other questions? All right, seeing none, I'm going to thank again Jeremy Brunson, our interim director for Medicaid and long-term care. Thank you very much for helping us put together this program to help out our long-term care facilities. Heath Bodie and Jennifer Cerno, thank you both very much for coming here today to talk about it from the provider standpoint. We really appreciate it. And again, we appreciate all the great work that the providers have been doing. Once again, Francis, thank you very much for doing a great job. And then just a reminder, folks, again, please avoid the 3 C's, those crowded places, close contacts, confined spaces. It's a virus, it spreads person to person, so please try to avoid that. Keep that 6 foot of distance between you and other people. Wash your hands often. If you cannot avoid one of those crowded places or 6 foot distance, wear a mask. That will slow the spread of the virus as well. That'll protect the other person, it'll help protect you. This week, we will be doing another press briefing on Thursday. We'll get a timeout to that. We don't have a time set for that. And then on Friday, I will be getting my flu shot, and there'll be a press availability for that. And that is Friday at Walgreens. I don't think do we have a time for that, Taylor? I think it's going to be in the 1 o'clock hour sometime, but we'll be doing a flu shot at Walgreens. And again, part of that is to remind people, get your flu shots. We want to make sure that you're staying as healthy as possible. A lot of the flu symptoms look like the coronavirus symptoms. So to avoid having to quarantine and wondering if you should stay home or staying home because you've got those symptoms, get your flu shot. That'll help make sure that we don't have that confusion between the coronavirus and the flu this fall. Again, folks, thank you all very much, and we'll see you again on Thursday.